in just days, if you're asymptomatic, you might be able to walk inside of a pharmacy and get yourself that COVID-19 test. We heard the government making this regulation change in order to increase capacity. We've been seeing these long lineups outside assessment centers with folks waiting on hours and to get this testing. But this also comes at an interesting time. Flu season is right around the corner, so some pharmacists might end up doing both.
This is our backlog wrapping around from St. Mike's to around our pharmacy. This is actually covering our entrance. So that's the backlog we're dealing with. We can see it from work every day. So yeah, I want to be part of that solution.
The reality of long COVID-19 lineups is visible from Cloud Pharmacy. As the province sees a spike in cases, staff at this pharmacy say they want to be part of the widespread solution and are on board with administering COVID-19 tests.
Pharmacists are always ready to step up and expand services when it's asked of them. It just has to be done with proper resources and guidelines so that we can do it right.
But pharmacists say they will need to make some changes for patient safety first, as to not heighten risks for other clients. Much of what they've done has been at their own cost, and they say they will need provincial support.
We would obviously have to retrofit and staff up a little bit. There's going to be a good amount of expense in doing that, so there has to be the funding that comes with it. Because when this first descended, we were doing our own COVID screening by phone.
The province has increased the number of tests administered, working towards 50,000 a day, hopefully with pharmacists functioning as testing centers soon.
Hopefully we'll have up to 60 pharmacies by the end of the week up and going, and then they're just going to continue ramping up.
That would probably be an appropriate place to send people who are asymptomatic, worried about their situation, but not necessarily exhibiting symptoms.
The Ontario Pharmacists Association is on board with this change in regulation, saying pharmacists will be screening to determine if a patient is having any symptoms or has had contact with positive cases. And if yes, they will be referred to an assessment center.
Faiza, this is unfolding almost by the minute, never mind by the day or hour. There's a lot of moving parts to this. There's a lot of work that we are still doing in conjunction with the Ministry of Health.
Pharmacy-administered testing has already rolled out in Alberta, with hundreds participating in the program. Ontario will be looking to that province for advice.
Pharmacists and pharmacy staff will need to plan accordingly. This might be through appointment-based types of modeling. This might be similar to what many pharmacists may be doing with the upcoming flu season, in order to minimize and control the number of people in a pharmacy at any given time.
The health minister says they are preparing for flu season, but whether pharmacies like Cloud Clinic can do both will be up to them to determine.
I think many pharmacies might choose to continue to do flu shots. Many others might choose to do COVID testing. Some might be equipped to do both.
Can you do both?
I doubt it, to be honest. We have a tight space. We work with the space that we have.
Now, Joseph tells me he's hoping the province will put pharmacists on the priority list for testing for healthcare workers, and it is something that they're supposed to be doing regularly, but these long lineups really do make it challenging. He adds that it's vital that the government come up with a funding model to assist pharmacists with what they need during this time, including proper PPEs.